If a child becomes sick and that disease makes the child blind, and when the child grows up and finds out that the blindness would have been prevented if necessary things were done by the parents or caregivers, at that point, will anything be a reasonable excuse? Maybe you tell the child you did not know the disease would cause blindness, or will you apologize to the child? What will you do? Juliana Ome is the name. Measles is the topic. Measles is one of the major causes of blindness in children in low-income countries. And measles is also one of the world's most contagious diseases. If a child in a daycare center or classroom comes down with measles, in a matter of days, almost every child in that group will come down with measles. Only children who have been vaccinated and attained immunity against the measles virus will be untouched by the infection. Even if a child who was vaccinated still contracts measles infection, the infection will be mild. Measles is caused by a germ called measles virus, and it is normally passed through direct contact or through the air. It is spread by coughing and sneezing, close personal contact or direct contact with infected secretions. Now, the virus infects the respiratory tracts and then spreads throughout the body. The virus remains active and contagious in the air or on infected surfaces for up to 2 hours. So if somebody with measles coughs on a table, for instance, up to 2 hours after that, anyone that touches that table will have access to live measles virus, and it can be transmitted by an infected person from 4 days before the measles rash appears on the body up to 4 days after the rash has erupted. Measles outbreak can result in epidemics that cause many deaths, especially amongst many young malnourished children. For example, in a particular community, at some point, children will come down with measles in large numbers. This is called an outbreak, and it can lead to death of children, especially if they were not properly vaccinated. In countries where measles has been largely eliminated, cases imported from other countries remain an important source of infection. Which child is at risk of having measles? Unvaccinated young children are at highest risk of measles and its complications, including death. Any non-immune person can become infected with measles. So if you give your child measles vaccine and the child does not develop immunity against measles, that child is very much at risk of contracting measles. Now, these are the things you will see and know that a child has measles. The first sign of measles is usually high fever, then runny nose, red and watery eyes, tiny white spot on the inside of the mouth, in the inner cheek. This is called coplic spot. Just open the mouth and check. Several days later, a rash develops starting from the face, from the forehead, behind the ears, to upper neck, and gradually spreads downward. Just where you wear a child's clothes, that's how the rash will spread throughout the body. After 5 to 7 days, the rash will clear in that same pattern to start from the face, clearing downwards throughout the body. And know that there is no specific antiviral treatment for measles virus in particular. So once you notice the child has signs of measles, take that child to the doctor, because severe complications from measles can be reduced through supportive care that the doctor will give to the child, especially if the child comes down with diarrhea and dehydration, high fever. In World Health Organization recommended ORS are given to the child, and some drips that you give to the child, and also antibiotic injections that we give to treat certain infections like ear, eye infections, and also pneumonia. And all children diagnosed with measles should receive 2 doses of vitamin A supplements, received at least 24 hours apart. This particular vitamin A supplement will help the child not to have complications like blindness caused by the measles infection. And vitamin A supplement has also been shown to reduce the number of measles deaths. In fact, measles is not what you treat at home, or you go to where they sell drugs, over-the-counter drugs, and then start giving your child the drugs. No, just go to the doctor. How best to help your child. Because if a child suffers from measles, it may lead to any of the following. These are called complications. Number 1 is pneumonia. I want us to know that pneumonia is the commonest cause of death in children with measles. Remember that the virus enters through the respiratory system, the nose, down to the lungs. so the child's lungs can get infected and that kills them very fast. The child can have blindness and also the infection that causes brain swelling. This is called encephalitis. It can take up to 7 to 10 years for a child to show this particular complication. You see, measles is not what you play with. The child can have severe diarrhea, dehydration, ear infections, febrile convulsions. And again, children are more likely to suffer severe measles infection if they were poorly nourished. They are not eating properly, especially those with insufficient vitamin A, or those whose immune systems have been weakened by diseases like HIV and AIDS. And serious complications are more common in children under the age of 5 years. But measles can be prevented. The first thing to do is immunization. Immunization, immunization, immunization. Give all children measles vaccine. Give them the routine and also the vaccines that are given on campaigns. When they tell you in the churches or mosques or in the schools that there will be vaccination for children, allow them to receive all the vaccines. And also you can give measles vaccine alone, or you give it together with other vaccines, what we call MMR, measles, mumps, rubella. They are all effective. And then vitamin A supplement is very important. Some mothers forget about immunization after 9 months. No, go for the vitamin A supplements and booster doses of other vaccines as well. And if a child is seen to have any sign of measles, that child should be isolated from other children. Again, ensure proper breastfeeding for all infants. Breast milk contains antibodies. These antibodies are like soldiers which help the body to fight germs, including measles germs. And make sure you give every newborn breast milk only for the first 6 months of life. This is called exclusive breastfeeding, before you add other quality feeds while you continue breastfeeding up to 2 years and beyond. Ignorance is not an excuse, and it is not a prevention strategy either. When a parent or caregiver says, "I don't know," the child will not be automatically protected from the disease. A child can suffer very severe consequences of a disease, whether the caregiver or the parent knows about the disease or not. So please, parents and caregivers, knowledge is what makes the difference between a healthy child and a sick child. Keep yourselves informed on all issues concerning child's health. Subscribe to my channel, stay connected, stay informed. Please get to watch Aubrey Health Talk videos on breastfeeding, diarrhea diseases, home care and prevention, childhood immunization, febrile convulsions. The links to all these videos are attached in the description box of this particular health talk. Once again, thank you very much for coming around to learn. Please feel free to use the comment section for your questions and your comments, and see you again.